Thank you for joining today's Web Interface support call. This presentation will be followed by a Q&A session where attendees will have an opportunity to ask questions via the phone and question box, and CMS subject matter experts will address as many questions as time allows. Also, to note, a recording and the slide deck from today's call will be posted on the QPP webinar library within the next 2 weeks. Now I'll turn it over to Sandra Slaughter at CMS to begin. Sandra?
Thank you, Haley. Welcome, everyone, and thank you for joining us today as Shared Savings Program ACOs prepare for quality reporting. I'm Sandra Slaughter from CMS. Joining me on the call today are other CMS experts and contractors who will share helpful information on CMS Web Interface quality reporting and answer your questions following today's presentation. Today's call will only focus on the 2024 CMS Web Interface quality reporting. You can contact the Quality Payment Program Service Center with any of your other questions regarding costs, promoting interoperability, MIPS, or quality reporting in general. Today's slide deck, recording, and transcript will be available on the QPP webinar library within the next 2 weeks. Next slide, please. This is a disclaimer slide about this presentation. Information in the presentation is current at the time it is published, but I urge you to please be sure you're using source documents and links that are provided throughout the presentation. Next slide, please. And next slide. The CMS Web Interface will close at 8 p.m. Eastern Time on March 31st, 2025. Your submission will automatically be accepted at submission close. As a reminder, the CMS Web Interface is accessible using the sign-in link on the Quality Payment Program website. Next slide, please. This is a schedule of upcoming CMS Web Interface support calls. And please note that the dates for the upcoming biweekly support calls are listed on the slide. More information and registration links can be found in the 2024 CMS Web Interface support flyer. Next slide, please. The 2024 CMS Web Interface measure specifications for the APM performance pathway, the CMS Web Interface measure specifications, and supporting documents for ACOs were published on the QPP resource library in December of 2023. These documents include submission release notes and coding release notes, which outline any changes that were made to the specifications from the 2023 performance period to the 2024 performance period. Next slide, please. The CMS Web Interface Application Program Interface, or API, is available all year for testing in the developer preview environment. There's narrative documentation and Swagger documentation for users reporting the CMS Web Interface measures via API. Next slide, please. This slide is about the extreme and uncontrollable circumstances exception. Next slide, please. The public health emergency for COVID-19 expired on May 11, 2023. Medicare Shared Savings Program ACOs are no longer affected by the COVID-19 PHE and will therefore not receive the program's quality EUC policy for COVID-19 PHE related to circumstances for performance year 2024. ACOs may still have the quality EUC applied for non-COVID-19 PHE-related circumstances like national disasters. Affected ACOs that report quality data via the APP and meet MIPS data completeness and case minimum requirements will receive the higher of their health equity adjusted quality performance score, or the 40th percentile MIPS quality performance category score for purposes of determining shared savings. Review the 2024 APM Performance Pathway Scoring Guide within the APP Toolkit for more detailed information on scoring. And now I'll hand things over to Deborah Plattenberg to cover other CMS approved reason requests and frequently asked measure questions.
Thanks, Sandra. And welcome once again to the first 2024 CMS Web Interface support call. My name is Deborah Kaldenberg, and I will be reviewing the next couple of topics, starting with the other CMS approved reason request process. Next slide, please. For those on the line that have submitted using the CMS Web Interface in the past, the process for submitting requests to skip patients has not been changed. As a general overview, each individual measure displays specific reasons why a patient may not qualify for the measure. Those exclusions and/or exceptions should be used when available and appropriate at the measure level. Another CMS-approved reason to skip is not needed and therefore should not be requested in those situations. Requesting another CMS-approved reason is a way to skip a patient attributed to a measure during denominator confirmation. It is reserved for circumstances that are unique, unusual, or not covered by any of the denominator exclusions or denominator exceptions identified in the measure specifications. In order to submit a request for a CMS-approved reason to skip, it must be submitted through the CMS Web Interface. And we request that you provide detailed information about why the patient should be skipped. This is necessary to ensure that we can get you a response as quickly as possible. Some things to keep in mind: it isn't necessary to request another CMS approved reason to skip if there is an applicable denominator exclusion, if there's an applicable denominator exception, if the patient is not qualified for the sample. For example, if the patient is deceased, in hospice, moved out of the country, or didn't have fee-for-service Medicare as their primary payer. Something else to note is pre-populated demographic information that isn't accurate can be updated within the CMS Web Interface. For example, if the date of birth is incorrect or the gender is incorrect. And when that is updated in the web interface, if it removes that patient from denominator eligibility, they will automatically be skipped and replaced. And one example of this is something we've already seen come through as a skip request, and that is to skip a patient who was identified as a female in the PREV-5 breast cancer screening measure, but that patient is actually male. In that regard, your skip request is not accurate. You should just update the demographic information and the patient will be skipped and replaced. Also, an example of a request that will be denied due to measure specification requirements is included, and that is Care 2 Falls Screening for Future Fall Risk. Any request to skip a patient due to non-ambulatory status will be denied, as the measure specification expects that a falls screen will occur for those patients. Next slide, please. Once submitted, additional information may be requested from the submitter via email from cms-wisupport@gdit.com. The email from this mailbox will be sent to the address entered by the submitter in the skip request. Please reply with the information requested as soon as possible. Again, this helps to expedite your request. Contact QPP at cms.hhs.gov for questions and include the skip request number in your inquiry. If multiple requests for additional detail are unanswered, the request will move forward in the review process using the information available. Once a decision has been issued, the request can't be reopened. If another CMS approved reason request is approved, the patient will be skipped and another patient must be reported in their place for the measure if available. If another CMS approved reason request is denied, the patient will remain incomplete until you complete reporting on the patient. Please note that submitting your request for another CMS approved reason during the last days of the submission period could cause your request to not be processed. So submit your request as soon as possible. More information on how to submit another approved reason request can be found starting on page 45 of the 2024 CMS Web Interface User Guide. Next slide, please. And for today, we will be reviewing how to access the patient's age for the frailty and advanced illness denominator exclusions, as well as some questions and responses for PREV7 influenza immunization, PREV12 depression screening, and MH1 depression remission at 12 months. Next slide, please. For the frailty and advanced illness denominator exclusions, these can be found in the posted DM2 diabetes hemoglobin A1C poor control, hypertension 2 controlling high blood pressure, PREV5 breast cancer screening, and PREV6 colorectal cancer screening measure specifications. The measure specifications state to assess the age for exclusions, the patient's age on the date of the encounter should be used. So which encounter should be used to make this determination? The measure specifications don't define which encounter to use when determining a patient's age for the frailty and advanced illness denominator exclusions. For this reason, the patient's age at the end of the measurement period should be used. The sampling process will account for this denominator exclusion through October 31st of 2024. The patient must be at least age 66 at the end of the measurement period and meet criteria to be excluded. The patient doesn't have to be age 66 when they meet criteria. They could be 65. Allowing the age to continue to be assessed based on the patient's age on the last day of the measurement period aligns with the 2024 sampling process and is consistent with 2023 and prior years. Next slide, please. Before we review the PREV7 information, I'll be handing it off to Alex for a PREV7 announcement. Alex?
Hey, good afternoon. Just doing a quick sound check. Can you hear me?
Yes, we can.
Okay, just real quick, I'm one of the contractors that supports the web interface application. We wanted to let you all know that we are aware that there is an issue that's affecting some people with the Excel upload for PREV7. It might not necessarily affect everyone, but right now some users are not able to upload the Excel document. They're getting an error related to PREV7 answers. So the team is aware of that issue. We have a fix in place. We're hoping that will be in the production environment later this afternoon. And once that happens, you guys should be unblocked and able to upload that Excel document. And I'll push that back to Deb.
All right, thanks, Alex. All right, now we'll dive in a little bit deeper into PREV7. So just to start with a general overview, if you've read the specifications, none of this will be new. The intent of this measure is for patients age 6 months and older seen for a visit during the measurement period to receive an influenza immunization, or you can report previous receipt of an influenza immunization. Again, this is defined in the posted measure specification. If you're looking at the use of telehealth for this measure, you can report previous receipt of an influenza immunization during the flu season that was done during a telehealth encounter. Obviously, the influenza immunization itself can't be completed during the telehealth encounter. Next slide, please. So for performance year 2024, The CMS Web Interface patient sample Excel files, and this is kind of a review of this information. On December 19th, 2024, CMS delivered a CMS Web Interface patient sample Excel file to each ACO reporting quality for performance year 24. The file contains the same patient sample that's available through the CMS Web Interface at the start of the CMS Web Interface reporting period that began on January 2nd, 2025. There are two variables used to identify which flu season or seasons that patients had an eligible encounter for the 2024 CMS Web Interface PREV7 measure. Those include the PREV7_23_24 flu, corresponding to the flu encounter timeframe of January 1st, 2024 to March 31st, 2024, that overlaps with the 2023-2024 flu season, and the PREV7_24_25 flu, which corresponds to the flu encounter timeframe of October 1st, 2024 to December 31st, 2024, that overlaps with the 2024-2025 flu season. All patients, regardless of whether they're ranked for the 2024 CMS Web Interface PREV7 measure as provided within your ACO's patient sample file, have both of the two variables coded as 1 equals patient does have a qualifying encounter or 0 patient does not have a qualifying encounter. However, for purposes of reporting the 2024 CMS Web Interface PREV7 measure via the CMS Web Interface, ACOs should concentrate on their ranked patients for PREV7. Next slide, please. For performance year 2024, the 2024 CMS Web Interface PREV7 measure captures 2 flu seasons during the measurement period. Those flu seasons are the 2023 to 2024 flu season and the 2024 to 2025 flu season. A CMS Web Interface measure is sampled and scored at the patient level. So performance on a measure is therefore either met, not met, or a denominator exception applies for each patient in the sample. In the case of the 2024 CMS Web Interface PREV7 measure, a patient is counted only once in the denominator and once in the numerator, whether the patient has a qualifying encounter for a single flu season or both flu seasons. The patient sample file contains 2 indicators that correspond to the 2 separate flu seasons, one for the 2023 to 2024 flu season and one for the 2024 to 2025 flu season. The indicator or indicators are checked if the beneficiary qualifies for the sample based on that time frame. If the beneficiary qualifies based on both time frames, then both indicators will be checked. Next slide, please. When a patient is sampled into only one flu season, performance will be evaluated based on the administration of the influenza immunization during that specific flu season. When a patient is sampled into both flu seasons, performance will be evaluated based on the administration of the immunization during both flu seasons. So I'm going to go through a breakdown here in text, and then we'll also see it visually in the next slide. Performance met will occur. This will be the outcome if the patient has documentation showing receipt of the immunization for the 2023 to 2024 flu season and the 2024-2025 flu season. Or if performance is met for one flu season, if the patient has a documented denominator exception for one flu season and they've received the vaccine for the other flu season. A denominator exception will be the outcome if there's a documented denominator exception for both flu seasons. Denominator exceptions must be documented during the measurement period and be specific to the flu season being reported. Performance will not be met when the patient hasn't received the influenza immunization for one or both flu seasons, or if the patient qualified for a denominator exception for one flu season and didn't receive the influenza immunization for the other flu season. this would be considered a performance not met. For example, the immunization wasn't administered in the 2023-2024 flu season, and a denominator exception was documented for the 2024-2025 flu season. Next slide. When a patient is sampled into both flu seasons, as previously stated, performance will be evaluated based on the administration of the immunization during both flu seasons. New for 2024, a denominator exclusion may be reported when a patient experiences anaphylaxis due to the vaccine administration during or before the measurement period. If a denominator exclusion is reported, the patient will be skipped and another patient must be submitted in their place if available. The patient will only be removed from the PREV 7 measure when a denominator exclusion is selected. And then this follows with a visual of what we previously went over, and I'll go over it again. 2023-2024 flu season is across the top, and the 2024-2025 flu season is along the side or vertical. So as you can see, if I was administered the influenza immunization in 2023-2024 and also 2024-2025, that meets performance. If the immunization was administered in 2023-2024 flu season and not administered in the 2024-2025, performance is not met. Again, if I have the immunization administered in 2023-2024 flu season, but a denominator exception is documented for 2024-2025, I will meet performance. The middle column, immunization not administered, this would be a performance not met. Anytime you have the immunization not administered in one flu season and you have anything else documented in the other flu season, this results in a performance not met. For your denominator exception in the 2023-2024 flu season, if you have influenza administered, the vaccine administered in 2024-2025, you will meet performance. If the 2024-2025 immunization is not administered and you have an exception in 2023-2024, it is a performance not met. If you have two denominator exceptions, one for each flu season, again, that is a denominator exception. Next slide, please. And now we will begin going over the PREV 7 frequently asked questions. The one thing I will say, we do have a posted 2024 CMS Web Interface FAQ document. You will see some of these same questions in that document as well as some others. So I would recommend downloading that resource as you're working through the web interface as well. So for PREV 7, our first question, for the 2024 CMS Web Interface PREV 7 Preventive Care and Screening Influenza Immunization Measure, are we required to report a patient's influenza immunization status for two separate flu seasons, or do we have the option of reporting for only one of the flu seasons? You must report immunization status specific to the flu season or seasons for which the patient had a qualifying encounter. The flu season in which the patient had a qualifying encounter will be noted in the CMS Web Interface. If the patient had a qualifying encounter during both flu seasons, you must report the patient's immunization status for both flu seasons. Question 2. How does the new denominator exclusion for anaphylaxis due to the influenza vaccine impact patients that are sampled into both flu seasons for the 2024 CMS Web Interface PREV 7 measure? To account for all possible clinical scenarios, CMS has implemented the use of a denominator exclusion or the option to report a denominator exception medical reason when necessary for patients sampled into both flu seasons. Each of these options offers two reporting pathways for patients with documented anaphylaxis. A denominator exclusion may be reported when a patient experiences anaphylaxis due to the vaccine administration during or before the measurement period. If a denominator exclusion is reported, the patient will be skipped and another patient must be submitted in their place if available. The patient will only be removed from the 2024 CMS Web Interface PREV7 measure when a denominator exclusion is selected. There must be medical record documentation supporting the use of the denominator exclusion if reported. Next slide, please. Question number 3. Is the denominator exception still available to report for the 2024 CMS Web Interface PREV7 measure? Yes, the denominator exception option is available within the CMS Web Interface and should be reported when there is documentation of an appropriate exception reason as defined in the measure specification. It would also be acceptable to confirm a patient with anaphylaxis in the denominator rather than reporting a denominator exclusion and report a denominator exception if the influenza immunization was administered for the 2023-2024 flu season, but the patient experienced anaphylaxis during the 2024-2025 flu season. In this case, you would report the anaphylaxis in 2020, or let me rephrase that. You would report in receipt in the 2023-2024 flu season, exception in the 2024-2025 flu season, and that would allow you to meet the requirements of influenza immunization for that particular patient. Also, the denominator exception in the 2023-2024 flu season is due to patient or system reasons, and anaphylaxis occurred during 2024-2025 to be reported as an exception. This will allow you to report the numerator outcome for the 2023-2024 flu season and a denominator exception medical reason due to anaphylaxis for the 2024-2025 flu season. And we know this is a little bit difficult and new, so please, if you have any questions and we aren't able to answer them on the call today, or this definition did not assist, you are welcome to open up a ServiceNow case and we will also provide you a written response. Next slide, please. Question number 4. Our state has an immunization registry. Can this be used as an extension of the medical record to qualify for the 2024 CMS Web Interface PREV7 measure? Any available medical record documentation, including immunization registry data, can be used to confirm the quality action. Question 5. Is a documented history of an egg allergy sufficient documentation to use the denominator exception for a medical reason for the CMS Web Interface PREV7 measure? No. A documented history of an egg allergy in the patient's medical record alone doesn't meet the intent of the denominator exception for the 2024 performance period. Documentation of an egg allergy must be during the measurement period and support that the allergy is still active during the appropriate time frame. Denominator exceptions must be documented during the measurement period and be specific to the flu season being reported. Question 6. What are the documentation timing requirements for the numerator for the 2024 CMS Web Interface PREV7 measure? The medical record should support that the refusal, exception, or receipt occurred during the appropriate time frame for the flu season being reported. The 2024 CMS Web Interface PREV7 documentation should be during the measurement period and be specific to the flu season being reported. If the medical record documentation supports that the quality action or exception submitted is relevant to the flu season being measured, it would be considered acceptable. Next slide, please. Next, we'll move into the PREV12 preventive care and screening for depression and follow-up plan. The intent of this measure is for patients aged 12 years and older screened for depression on the date of the encounter or up to 14 days prior to the date of the encounter using an age-appropriate standardized depression screening tool, and if positive, a follow-up plan is documented on the date of or up to 2 days after the date of the qualifying encounter. In regards to the telehealth, screening for depression may be completed during a telehealth encounter. Documentation of recommended follow-up plan for a positive depression screen may be completed during a telehealth encounter. Next slide, please. So here are frequently asked questions for the PREV 12 measure. Question number 1. Previously, a follow-up plan had to be documented on the date of the encounter, but the 2024 CMS Web Interface PREV 12 measure specifications state that it may be documented up to 2 days after the date of the qualifying encounter. Is that correct? Yes. For the 2024 CMS Web Interface PREV 12 measure, a follow-up plan must be documented within 2 calendar days after the qualifying encounter, either telehealth or office visit. However, the follow-up plan must still be provided for and discussed with the patient during the qualifying encounter used to evaluate the numerator. Question 2. Can documentation of a follow-up plan be used to infer a depression screening was positive if no results were documented? No. The depression screening results must be reviewed, verified, and documented in the medical record by the eligible professional to meet the screening portion of this measure. Question 3. Should patients with any history of bipolar disorder be excluded from the measure? Yes. The intent of the measure is to screen for new cases of depression in patients who have never had a diagnosis of bipolar disorder prior to the qualifying encounter used to evaluate the numerator. To implement this guidance, the qualifying encounter is the equivalent to the most recent depression screening. A patient should be excluded if they've ever been diagnosed with bipolar disorder prior to the qualifying encounter used to evaluate the numerator. Question 4. Does a certain condition, such as intellectual disability, impairment, Alzheimer's, dementia, or autism, qualify a patient for a denominator exception? The specification doesn't define denominator exceptions by specific diagnosis. If the patient qualifies for the measure, and there's medical record documentation that the patient wasn't screened for depression due to a medical reason, i.e. cognitive, functional, or motivational limitations that may impact accuracy of results, or patient is in an urgent or emergent situation where time is of the essence, and to delay treatment would jeopardize the patient's health status, then it would be appropriate to select the denominator exception. Another way to think about this is if you have a patient, let's say, that has Alzheimer's, and it is documented in the medical record that the patient was not screened due to the Alzheimer's for depression, this would meet that medical exception. But again, if you have additional questions, we'll either try and get to them during this presentation, or you are welcome to open up a ServiceNow help desk case. Next slide, please. Question number 5 for PREV 12. Does conducting a PHQ-9 after a positive PHQ-2 count as appropriate follow-up for the measure as it has in the past? And the response here is no. Per the 2024 CMS Web Interface PREV 12 measure specification, additional screening and assessment during the qualifying encounter doesn't qualify as a follow-up plan. Question 6. Can we confirm the numerator if the medical record only contains the name of the tool and interpretation by the clinician? Yes, at a minimum, you must document the tool's name and results of the screening with a score or a clinical interpretation of positive or negative for depression. Question 7. For patients with a depression diagnosis, does the clinician have to track or complete the recommended follow-up with the patient, changing the medication dose or other approved intervention to meet the numerator? Or does the existence of an active medication pre-screening suffice as a follow-up to the screening? No, the 2024 CMS Web Interface Prev 12 measure specification doesn't require the clinician who performed the depression screening to track or complete the recommended follow-up. However, if the clinician determines that the results of the depression screening is positive, there must be documentation of a recommended follow-up plan in the medical record. Documentation of ongoing pharmacological intervention or continuation of another approved intervention would be considered an appropriate follow-up plan, noting that documentation of the follow-up plan, for example, continuation of depression medication, must be in relation to the positive depression screening. Question 8. The 2024 CMS Web Interface Prev 12 measure specification states that the results must be reviewed, verified, and documented by the eligible professional in the medical record on the date of the encounter to meet the screening portion of the measure. What is the definition of an eligible professional? The intent of this statement is to clarify that the quality action must be completed by an eligible clinician. However, others within the organization may complete the action. The quality action can be completed by anyone the organization considers qualified. Next slide, please. And now we're going to cover MH1 depression remission at 12 months. And one thing to highlight is that these measures have very different purposes, and I'm referring to the Prev 12 and the MH1. And they are stewarded by different measure developers. Therefore, you will see differences between these measures. Please note those are intentional based on feedback from the measure developers. So for MH1 depression remission at 12 months, the intent is for adolescent patients 12 to 17 years of age and adults, patients aged 18 years of age or older with major depression or dysthymia who reach remission 12 months plus or minus 60 days after an index date. Regarding use of telehealth, documentation of a follow-up PHQ-9 or PHQ-9M result less than 5 may be determined during a telehealth encounter. Next slide, please. And for the frequently asked questions for MH1, question 1, for 2024 CMS Web Interface, MH1 depression remission at 12 months, a PHQ-9 has been completed for the patient on a paper form and scanned into the medical record, but the score wasn't totaled. Is it acceptable to calculate the score during abstraction? No. If the score isn't totaled in the medical record documentation, you must select no when asked if the patient had one or more PHQ-9s or PHQ-9Ms administered during the denominator identification. Documentation of a follow-up PHQ-9 or PHQ-9M with a score less than 5 is also required to determine the patient achieved remission for the numerator. Question 2. If a patient answers the first 2 questions of the PHQ-9 or PHQ-9M not at all, and the rest of the questions are blank, is the depression screening considered numerator compliant? No, all 9 questions must be answered to have a valid summary score for a follow-up PHQ-9 or PHQ-9M. There must be medical record documentation of the score and the date the PHQ-9 or PHQ-9M was completed. Question 3. Since the age range of 2024 CMS Web Interface MH1 measure is 12 to 17 years old and 18 and older, can we use the PHQ-9 for all of our patients? Yes. You may use either the PHQ-9 or PHQ-9M tool to meet the intent of the 2024 CMS Web Interface MH1 measure. Question 4. Can the PHQ-9 or PHQ-9M be performed inpatient, or should it be performed during outpatient encounters only? The 2024 CMS Web Interface MH1 measure specification doesn't limit the PHQ-9 or PHQ-9M screening to a specific setting. Next slide, please. Question 5. Can the PHQ-9 or PHQ-9M be performed during a telehealth visit? Yes. The PHQ-9 or PHQ-9M may be performed using telehealth. PHQ-9 or PHQ-9M administration doesn't require a face-to-face visit. Multiple modes of administration are acceptable: telephone, mail, e-visit, email, patient portal, iPad, tablet, or patient kiosk. Question 6. Can you please clarify the timing used to identify denominator exclusions? For denominator exclusions that require a specific diagnosis, the diagnosis must be active any time prior to the end of the patient's measure assessment period. The index event date marks the start of the measurement assessment period for each patient, which is 14 months, 12 months plus or minus 60 days. Question 7. Can you explain how to determine the index event date? First, verify the patient has an active diagnosis of major depression or dysthymia during the denominator identification period. That would be 11/1 of 2022 to 10/31/2023. And then 2, the first instance of a PHQ-9 or PHQ-9M greater than 9 during this same time period is the index date. Please refer to the step-by-step submission guidance and measure confirmation flow in the 2024 CMS Web Interface MH1 measure specification. Next slide, please. And now I'll hand it back over to Sandra for the resources and where to go for help. Thank you.
Thank you, Deb. These next few slides will outline the available CMS Web Interface resources. Next slide, please. Please note that the 2024 submission resources are available on the Quality Payment Program Resource Library. Direct links to these resources will be distributed in the ACO Spotlight newsletter. We encourage you to review these documents if you have questions on quality requirements and the measures. Next slide, please. If you need additional assistance, please refer to the contact information listed on this slide. And now I'll hand things over to Haley to begin the Q&A session.
Thanks, Sandra. So we're now going to start the Q&A portion of the webinar. You can ask questions via the Q&A box or through the webinar audio. If you want to ask a question through the webinar audio, please raise your hand and we'll unmute your line so that you can speak. To submit a question via the Q&A box, please click Send Anonymous. To submit a question anonymously via the Q&A box, please click Send Anonymously. Otherwise, all attendees will be able to view your question. And just a note that if you want to ask a question over the phone, you need to have a working microphone. So we have a couple of questions on the line. The first one's from Antoinette. Antoinette, we've unmuted your line if you'd like to unmute yourself. Antoinette, are you there? All right, we will come back to you. Our next question on the line is from Sheila. Sheila, we have unmuted your line if you would like to unmute yourself.
Yes, thank you. I also put it in the chat box, but I believe there is a programming error for Measure Prev 13, the statin, in that population 1 is defined as all patients with ASCVD, according to the measure specification, but 118 of the patients are marked in my ACO as not eligible due to age, and there is no age restriction on population 1. Meanwhile, population 2 is defined as patients age 20 to 75, with an LDL-C above 190 or pure hypercholesterolemia, which does have an age limitation, and 0 of my patients are marked. And when I go into the web interface itself, it's set that way as well. So either the downloaded spreadsheet or in the computer online access, I cannot change it on population 1 from not eligible to the actual answer, and the restriction is not being applied where it should be. So it's reversed, and when I set in a ticket, the response I received was, oh, it doesn't say that in the narrative, but we'll ignore anybody age 20 to 75. But it's not population 1, it's population 2.
This is Deb from the Measures team. I do just want, because I happen to see one of the ServiceNow cases, and I can confirm that there is no age requirement for that first population. I think this is going to require multiple folks on the call to either be able to address. So I'm not sure if there's others on the call that would like us to kind of come back to this through a ServiceNow case to work it out, or if there's any additional information we can provide today.
Okay. And I will note that I have spoken with a colleague. This is not just me. This is system-wide.
Yes, I appreciate that. And like I said, if you still have an open case, I would say let's work through that case. And one of the things we can do is we can make sure that Prev 13 is the measure that we go ahead, one of the measures that we cover at the next support call. I'm sure that you'll probably be able to get an answer prior to that, but we can make sure that anybody on this call also has this information kind of covered at the next support call as well. But I don't know if there's anyone else on the call currently, if there's any additional information that we can provide this caller at this time, or if we just want to go ahead and continue to work through the ServiceNow case.
Yeah, I think we want to move ahead and we'll discuss this after.
Sounds great. Thank you.
All right, thank you for that question. The next question we have is from the Q&A box for Deb. And Deb, the question reads, specific to Prev 5 patient confirmation, are we required to use the CMS provided responses of not confirmed age if we determine otherwise?
And for this one, again, it may require some additional folks to be able to fill in. I do want to say that for Prev 5, I don't think you should be required to say not confirmed age if you're able to determine that that patient is qualified for the sample or for that measure, I'm sorry. But if there's additional information that can be provided to this caller, that would be great.
Sure. So through the user interface, you can go in and update the date of birth if it's incorrect. That would recalculate the age. And if the date of birth makes it so that they are eligible for that measure, then that automated sort of response of not confirmed for age will disappear and you'll be able to respond.
Okay, thank you. The next question we have on the line is from Jason. Jason, we have unmuted your line if you'd like to unmute yourself.
Can you hear me?
Yes.
Yes, if you could go back to slide, I think it's 25, please. Yes, thank you. It's number 6. I just want to be crystal clear about this because there was much discussion last year. So am I correct that as long as a depression screening was given, responded to, and that the score was verified, that would meet the numerator, regardless of any clinician interpretation? Is that correct?
Jason, I'm having problems for some reason seeing the actual slide, but I do think in regards to this, there has to be, you don't have to have a score, but you do have to be able to identify whether or not the results of that screening were positive or negative.
Okay, so that's not what it says on the screen. It says you must document the tool's name and results of the screening with a score or a clinician interpretation of positive or negative.
So if you have the score, if you know that is directly from the measure specification, I believe. If you have a score and you have moved forward based on the fact that that verification from the clinician is based on the score, you have documented a follow-up is necessary, or you don't need a follow-up because that has been determined to be negative, that would be acceptable.
So this is still unclear to me. Again, so like, let's say the patient scores, takes a PHQ-9 and scores a 3. And it's determined that there's no action needed based on our, healthcare policy. And that is recorded in the medical record. Does that meet the numerator requirements? Because the score was written and the screening was given.
Okay, I am so sorry, Jason. I just got back to that slide. I was having some technical difficulties. I'm going to ask if you don't mind going ahead and submitting a ServiceNow case so that we can make sure that we give one answer that is clear to you, and then we will also again come back to this group in the next support call and confirm that this particular question. And could you give me the number of the question that's causing confusion?
Yeah, it's number 6.
Okay, thank you. And that way we can also redo question 6 to confirm that everybody has the same understanding. If you don't mind doing that, that would be great.
Sure.
Thank you.
Our next question on the line is from Lisa. Lisa, we have unmuted your line if you'd like to unmute yourself. All right, Lisa, I see you have lowered your hand. The next question we have in the chat box is also for Deb, and the question reads, for depression screening, can we use score or negative or positive?
So I think this is going to be the similar one to what Jason was just saying was causing some confusion. And I want to make sure that I don't create any additional confusion. So we will ensure that this is answered on the next support call. But if this particular caller also wants it in writing, if you open up a ServiceNow case, we'll be able to get you the same answer we will provide Jason. Thank you.
Thanks, Deb. Our next question on the line is from Hannah. Hannah, we've unmuted your line if you'd like to unmute yourself. Okay, Hannah, I see you put your hand down as well. That takes us to the end of our question queue for right now. So we would just like to take a second to encourage anyone who may have a question to go ahead and type your question in the Q&A box, or take advantage of the opportunity to ask your question over the phone by using the raised hand function, and we can get your question answered out loud.
Hallie, I went ahead and marked one question to respond to. I don't know if that's come through, and if I can find it again, I'll read it out loud, but it does have something to do with explaining why for MH1, I think I found it. Can you clarify why we can't score a validated, reliable, evidence-based scale like the PHQ-9 to determine a number for MH1? And the reason for that is based on feedback we received from the measure developer of that particular measure. They, for their purposes, in order for that PHQ-9 score to count, it would be validated and scored by the eligible clinician. It wouldn't be done at abstraction. So if that didn't answer your question, please feel free to re-ask and I'll try and explain that a little bit better.
Thanks, Deb.
And then also, Hallie, somebody is asking for a link to submit the ServiceNow ticket. I know that there's information on how to do that, but didn't know if that was something you'd be able to share.
Yeah, we can definitely get, excuse me, that information out to folks.
Thank you.
Just wanted to do another call to see if anyone else had a question they would like to ask over the line. Or a question you'd like to type into the chat box. If you would like to keep it anonymous, you are welcome to mark as anonymous and it will be done as such. We do have another question in the box for Deb for MH1 where everything is marked 0, so clinicians didn't actually score because of how we give guidance on other depression measures.
So the one thing I would recommend here is to make sure that you're following the measure specification. If you're saying that that patient met denominator criteria and they have an index date where they met all that information, you're trying to determine if the patient has achieved remission within the proper time period. You would be redoing that PHQ-9 or PHQ-9M and having a score and documentation. Obviously, if there is a 0, that to me is indicative of a score, but I would ensure that you're kind of working through that MH1 measure as it's one of the more complicated, just ensuring that you are following all of the steps and the timeframes associated because you're looking during the performance period for a remission, that the depression itself and that higher score occurred outside the 2024 year. So if you have additional questions, please feel free to ask.
Thank you. We have another question on the line from Sydney. Sydney, we've unmuted your line if you'd like to unmute yourself.
Can you hear me?
Yes.
Okay. The question is on because CMS, we are using web interface reporting, right? So there's another option is that CMS generate an Excel file so that you can fill out the answers there. I noticed that it looks like the flu vaccination description, the day range looks like is not entirely correct. So I wonder whether CMS noticed that or whether they have any like corrective actions that would be done on that.
I believe this is something that was covered earlier. Alex, I don't know if this was the issue you were talking about or if there was something different going on, but I believe this is something that has been corrected. And if you find that you have still some things that are not lining up correctly, it would probably be best for your specific situation to kind of open up a ServiceNow case to ensure that the right people are able to take a look at that and confirm that everything has been corrected or what your next steps would be.
Yeah, I'm sorry. I was just typing in the chat as well. So there were a few individuals who I think there are like 12 different organizations who downloaded the Excel template and it had incorrect dates on it. That was resolved within a couple hours of the submission window opening. So you might, I don't know if you've tried to re-download the template and you're still seeing those incorrect dates.
I don't know, Hallie, if you can unmute Sydney. I think that was Alex was asking him to confirm or if we just want to move on.
Yes, this is in here. Thanks for the answer. Actually, Jamie put in a response in the chat box. I think that what I have not done is that I have not really because we download the file and have not looked into the whether there's an update or anything like that. So what I would do is just to follow up and whether they have a revised or corrected version there. So that and if you say that if it's still the issue have not resolved, then probably I will put in a ticket or something. Yeah, thank you.
That's great. Thank you.
Yes.
All right, thank you both. Wanted to do another call to see if anyone had a question they would like to ask over the phone. In the meantime, we do have another question in the chat for Deb. And the question reads, is there additional information you can provide regarding the new statin requirement below? Patients aged 40 to 75 at the beginning of the measurement period with a 10-year ASCVD risk score of greater than or equal to 20%. Where should we look in the patient's medical record for this information?
So I can't tell you where to look for the information. I can provide, and maybe you've already fully reviewed the measure specification, and that's why you're asking the question. I will say a lot of times the coding document can be of assistance if for no other reason that it can help you find in the medical record what you're looking for. Unfortunately, where to find it is not something that I can provide. I can only help with understanding the intent of the measure itself. What I did want to ensure to communicate is that we will have an overview of Prev 13 at the next call. But if there are some very specific questions about the Prev 13 measure itself, I can try and answer those today, or others that have that experience that are on the call with me will also try and do that as well. But that's kind of what I wanted to communicate. We will ensure that Prep 13 is covered at the next TOR call. If you happen to have a specific question and can't wait until that call, and you don't come up with a question during today's call, you're welcome to send that through the ServiceNow help desk as well. Thank you.
Thanks, Deb. Our next question in the queue is for it's for Jamie. And the question reads, is there a nice summary of differences between the 2023 and 2024 metric specs that we can download
Yep. Hello, Margaret. This is Jamie. If you go out to the QPP or the Quality Payment Program Resource Library and open up the file that contains the specifications for web interface and the coding documentation for web interface, there are two documents. They're called release notes. There's release notes for the coding documents, and there is a release notes for the specifications themselves. And hopefully that gives you a nice overview and helps out with any changes made between the 2023 and 2024 program or performance years. Thanks.
Thank you. We once again want to invite you to ask any questions you may have by raising your hand or by entering your question into the Q&A box. As a reminder, you do need a working microphone to ask your question over the phone, and then you can also click Ask Anonymously in the Q&A box if you would like your answer to or your question to remain anonymous. Also, as a reminder, we will be posting all of the materials from today's webinar on the QPP library in the next 2 weeks.
Hey, Hallie, I think there's a couple of Care 2 questions that we should be able to cover. If you just give us a couple of seconds, we're just double checking some information. One of them is the very last question that has come in. And I believe we do have Arush has identified that to answer live.
Thank you, Deb. So a clinician with appropriate skills and experience may perform the screening.
And to clarify, that question was for Care 2. Can you please clarify who is qualified to close this quality action?
Correct.
Thank you. All right, we are going to do one last call to see if anyone would like to ask a question. There's one more question in the queue for Jamie. The question reads, does documentation of fall precaution meet the fall measure? Jamie?
Yep, thank you so much for this question. We had to review that the specification real quick. Within the specification, and we don't normally comment on how to specifically document these types of assessments within your medical record. And what we do generally is we point back to the specification itself. And within the specification, it says documentation of no falls is sufficient, or a gait or balance assessment meets the intent of the measure. But for any reason, if you still need clarity on this particular question or guidance, please reach out and provide a ServiceNow inquiry. We'll help you. Thanks.
All right, thank you, Jamie. That takes us to the end of our question queue, so we are going to go ahead and wrap up the Q&A portion for today's webinar. I'll turn it back to Sandra to conclude the call. Sandra?
Thank you, Haley. And thank you everyone for joining us today. As a reminder, the slide deck recording and transcript from today's call will be available in the QPP webinar library in the next 2 weeks. The next CMS Web Interface support call will occur on January 22nd, 2025. Thank you.